Good morning, everyone. Today we are reporting 105 new cases of COVID-19 in the state of South Dakota. This does include 5 new hospitalizations and 4 new deaths that have been reported. The counties where those individuals reside include 1 in Minnehaha, 1 in Oglala Lakota, and 2 in Pennington County. We've had a total of 65 newly recovered individuals, and we've had a total of 1,781 new tests that were reported in the past 24 hours. This does bring our total COVID-19 case count to 9,273 COVID-19 cases in the state. Of those, 987 are active infections, and 8,145 are considered recovered. Today we have 44 individuals who are currently hospitalized, and this does bring our total deaths in the state up to 141. We have had a total of 147,336 total tests that have been reported to the Department of Health. Of those, we've had 117,574 unique individuals, and again, 9,273 of those testing positive and being cases that we've reported out. For our community impact map, we have updates. Roberts County has been elevated to substantial community spread. Custer and McPherson counties have been lowered to minimal to moderate community spread. For our cluster updates, we've had 12 from McCrosson's Boys Ranch. We've had 12 individuals who have recovered out of the 37 staff and residents that have been identified as COVID-19 cases. And for Camp Judson, we've had 70 individuals who have recovered out of the 94 campers and staff that have tested positive for COVID-19. I would like to introduce Jonathan Steinberg, as Derek had mentioned, who's our Epidemic Intelligence Service Officer, and is working with us on this analysis that he's going to be talking about. I do want to note that there is a difference in the number of total cases that were identified among Smithfield employees from the 853 that were identified as part of our cluster that we reported out, and that the 929 cases that he's going to be talking about include some additional individuals that were identified after we had completed the matching of the staffing list from Smithfield Foods specifically. So with that, I will go ahead and turn it over to Jonathan Steinberg.
Thank you, Josh. Good morning, everyone. Please note that the following information is under embargo until noon today. Today we're reporting on our article, COVID-19 Outbreak Among Employees at a Meat Processing Facility, South Dakota, March to April 2020, which is being published in CDC's Morbidity and Mortality Weekly Report this week. Our analysis showed that COVID-19 spread rapidly among employees at a meat processing facility in South Dakota. In less than 3 weeks, the number of identified COVID-19 cases increased from 1 to more than 300. In a total of 5 weeks, the number of cases surpassed 900. This report highlights the potential for rapid spread of SARS-CoV-2, the virus that causes COVID-19, among employees in meat and poultry processing facilities. Employers should prioritize implementing multiple control measures to limit the risk of exposure to COVID-19 because no single measure likely will eliminate transmission. Examples include promoting physical distance between employees when possible, encouraging mask use and hand hygiene, screening employees for possible infection. Detailed guidelines for meat and poultry processing workers are published on the CDC website.
Thank you, Jonathan. And again, that article will be posted on CDC's website, cdc.gov/MMWR, Morbidity and Mortality Weekly Report, MMWR, and you can access that article here shortly after noon Central Time. I'm going to go ahead and unmute the lines, and then we will be able to take your questions. We're ready for your questions.
Good morning, JP from KORN News Radio.
Go ahead, JP.
Thank you very much. Had a question regarding death certificates. Now, you folks are supplied with death certificates within 5 days of, I believe, that a person had died of COVID. After that time, is there any possibility that a death certificate could be revised regarding the cause of death? And if that has happened, how many times has it happened so far in the deaths reported in South Dakota?
So, JP, we do know that there is a process that medical providers or coroners can go through if they do feel that they need to update, death certificates, and that's a generalized process that they can go through for any death and not specifically related to COVID-19. I don't honestly know the number of the rate maybe of changes within death certificates. I believe it is infrequent, and I don't know the transition of cases related to or that have been identified as being COVID-19 deaths as well. I think a lot of the medical providers and coroners are looking at the patient's medical history, taking into account their any chronic conditions that they may have, as well as any COVID-19 testing and other testing for infectious diseases, and taking that into account in their certification of that death. And so I guess I'll leave it at that.
Thanks.
Next question.
This is Lisa, District Leader.
Go to Lisa.
Yeah, I'm just wondering why you decided to change to reporting the total number of tests 5 months into the pandemic, and why you haven't been doing that for the first few months.
Lisa, this is Kim Elson-Rice, and so as part of our evolving strategy in response to COVID, we were able to, and then of course, I think people are very aware that initially there are a lot of issues with supply chain and development of tests, and so the real fact of the matter is that that testing has evolved since we've started our response to COVID, and so starting in May, we identified a monthly goal with a target number of tests that we wanted to see completed. And we have those monthly goals now through December, and anticipate, revisiting those numbers and seeing what 2021 will bring us for that. So it's just a function of the evolving response.
Next question.
Jack Cottle, KEVN and KOTA. Had a question about Camp Judson. You said 94 cases. Is that just the South Dakota cases? And if so, how many cases are there from out of state, and have there still not been anyone hospitalized?
So that is correct that the 70 individuals have recovered out of 94 cases, includes only South Dakota residents. We are aware that there are 43 campers or staff that were in attendance at Camp Judson, and that are from out of state, and that we're aware of. I think it was 3 cases. I don't have that directly in front of me, but I'm certain that there were 3 cases that were identified, and that we have test result for. But as far as the remainder of the other 40, I don't have that information. That would be residing with the individual state in which those campers and staff reside.
Furthermore, there have not been any hospitalizations amongst any of the folks that were positive from that event.
Next question.
Ray Yost from Kelland.
Go ahead, Ray.
Hi, I'm curious, with Sturgis coming up, as public health officials or just as individuals, would either of you attend the Sturgis rally? And if you knew someone was going, would you have some recommendations for how they should handle themselves?
Well, Ray, this is Kim Elson-Rice, and I'm not attending the rally. We have staff that will be helping with certain functions at the rally, and we're making sure that they feel comfortable and safe doing that. The guidance for that is obviously to maintain social distancing as much as possible, pay attention to hygiene, and ensure that they're washing hands frequently, masking when they can't maintain social distancing, and just otherwise trying to stay away from folks that could in fact be transmitting the disease.
And this is Dr. Clayton. I mean, one of the things that we've been very transparent about is that, anytime that you're bringing people together, especially if you're bringing individuals together from areas that might have higher risk of COVID-19 in their general communities, whether that be a state or a county, that does pose a risk for COVID-19 transmission, and that's regardless of whether it's the Sturgis rally or somebody's backyard picnic, that they might have over a weekend. Individuals do need to take proper precautions, in all of those circumstances, and consider, what they want to do individually and whether they want to attend those events.
Next question. Go ahead.
Well, just, you mentioned backyard picnic in Sturgis. Is it fair to say those aren't even remotely close to being the same thing?
They are the same when it comes to a risk for transmission of COVID-19. When you're talking about, if you're talking about a backyard picnic where you're inviting, family from multiple different states, some of those that might be in areas that have higher risk of transmission, there is a process that people need to go through in terms of their own decision making about whether they're going to attend. And I was just relating that individuals really should not be they need to differentiate what event that they're going to, what sort of risk that is associated with. And so if you're going to a backyard picnic with 3 people versus 300, that's a magnitude of a difference in terms of what you might be taking on as an individual risk. And so when that backyard picnic ends up being 300,000 people at a Sturgis motorcycle rally, there's still that decision making that needs to take place about the risk that's involved.
Next question.
Thank you.
Todd Epp, Kello.com News.
We'll go to Todd, and then I heard the Rapid City Journal.
Just a comment. Darn, I guess I'm not going to see you guys at the rally then. Is that correct?
Unless you're driving through Pier, Todd.
Darn, I was looking forward to that. Seriously, your boss, Governor Noem, has been on several national talk shows talking about that we in the media are not presenting the positive stories about the coronavirus. I guess I would note that we largely cover what you all tell us, at least in South Dakota, and we're reporting the numbers that you present. So today we have 4 more deaths. So how do we spin that as a positive story? What should we be reporting that's positive that we're not reporting?
Well, Todd, this is Kim, and I guess I think one thing that you can help us do is to continue to remind people that they do have the ability to help protect themselves against COVID. We are not helpless in that regard. Most people do, in fact, have very mild symptoms. They fully recover. We do know that there are certain individuals that are more vulnerable to poor outcomes, and including death, and that tends to be people that are older or who have underlying health conditions. And so continuing just to tell that story so that people don't misremember those facts, and that they're able to make rational decisions about their actions moving forward.
We'll go to the Rapid City Journal.
Thank you. So with Sturgis, you mentioned that some Department of Health staff will be going to the area to, can you talk about what they're doing there and what kind of precautions they're taking, and any additional preparations that, the Department of Health might be helping out our local hospital system with, or that kind of thing?
Sure. So at events like the rally, the Department of Health works with vendors, especially food vendors, to make sure that they're complying with food safety kinds of regulations so that we can minimize, food poisoning and foodborne outbreaks. And so that's a function that we play at events like the rally. We also conduct water testing for campgrounds and other places where we know there will be gatherings of people to make sure that the water supply is safe. So that's just an example of the two most common functions. We also, at the request of the City of Sturgis, inspect tattoo establishments and, again, make sure that health and safety requirements are being met. There are other state agencies that also have staff that work at the rally, and we provided guidance and information to all of those employees about how they can keep themselves safe. Again, the CDC guidance is pretty clear. Maintain social distancing, minimize, your face-to-face contact with individuals to the greatest extent possible. Use PPE in situations where you do need to be closer to folks, and good hand hygiene and regular hygiene is really important as well.
You mentioned that they're coming for food and tattoo safety, but are they coming for anything related to coronavirus? Are they helping with testing?
So the City of Sturgis would be the best contact for some of the testing strategies that they'll be employing. They will be looking at doing some testing in the community of Sturgis after the rally is completed.
Okay, my next question about that is if a lot of people are coming from out of state for the rally and then maybe they get sick when they go home a few days later, how is South Dakota going to keep an accurate case count of any, outbreaks that we're seeing at Sturgis? How will you be tracking that and giving case updates in these calls?
Well, again, we will be able to provide information about any South Dakota cases that rise to the level of a cluster, and if it's related to an event like the rally, we will be providing that information. Cases that are among residents of other states are reported as cases in those states, and so that will not be part of our updates.
But the one thing that Secretary Malcolm mentioned, the cases that are identified in those other states, the issues around close contacts that might be identified that are South Dakota residents, or areas of concern where those close contacts are not fully identified, so they were around other individuals while not wearing personal protective equipment and not being able to be physically distanced. In those circumstances, states would notify the South Dakota Department of Health, and we would issue a public notice. So, there are processes in place, and we have used these for other events, COVID-19 and beyond.
The other thing I would just mention is that we have deployed a number, I believe it's 9 Abbott ID machines out West River, including Rapid City, Sturgis, Custer, and other towns to help with testing. We've also provided 5,000 tests to those providers so that they have increased ability to handle potentially more volume.
Next question.
Gordon Richard, the Alcester Union Hut tonight.
I heard that Alcester Union Hut tonight.
Yeah, Dr. Freeberg, the analysis that's going to be published today, does that speak or kind of evaluate the company's response? And does it give them, added things that they need to do in an ongoing manner?
No, it does not. The analysis that we conducted and the report that's going to be published today was specifically looking at infections among employees and was not an evaluation of interventions implemented by the facility.
And this is Dr. Clayton. One of the things that I'll just say in follow-up is that, we do use our cluster updates as a way of notifying the media and the general public when businesses are seeing substantial increases in cases. And so it is noteworthy that since the temporary closure, of the facility in the state, that we have back to the cluster update list as being having a concern for increased number of cases. I think that in and of itself is a very telling of risk within any potential risk within the facility.
Next question.
Josh,
Ray from
Dakota News
California.
Now.
We'll go to Dakota News Now.
So on the state's COVID website, under the trends section, the positivity rate for the last 1 day is showing 5.4%. Just wondering how you guys came to that number, because based off the data you released the past 2 days, today it was around 8.75%, and yesterday it was just under 9%. So I'm just wondering how you arrived at that 5.4%.
Yes, so that is specifically looking at, and there are a couple different test positivity rates. So that looks at within a 24-hour period, and that is different than the reporting period that we are using for updates to folks in the media. Because for the media we're using 1 p.m. to 1 p.m. And for the percent positivity, we're looking at the entire day. So 12:01 to midnight is the period for that test positivity rate. And so that number is taken. You take the total number of tests as the denominator, and the number of those tests that were positive within that 24-hour period as the numerator, and you divide that and produce that percent of currently 5.4%.
So if I could just maybe use the example of today's numbers that we just reported to you. We reported 105 new cases, so those are positives, and also 1,781 negative cases. If you add that numbers together and divide 105 new cases by the 1886 total, that's about 5.5% positivity.
Well, you had 105 positive cases, but I think there was only in today's tally was around 1,100, because I think the total tests that...
No, 1,781 negative tests.
I guess the total numbers that we saw today was the total test of 1,200, based off of today's number. That's what the data you guys released today. That's what we got.
So 1,781 new tests that have been performed was the total tests that were performed today. Of those, 105 are new cases, and I want to be cautious because there may have been additional tests that were positive for individuals that were previously reported as cases. So I think to help refocus this, it's again that 24-hour period, the full day, total tests that have been performed is the denominator. The number of positive tests, regardless of individuals, is the numerator. So you divide the numerator over the denominator, multiply by 100 to get 5.4%.
Next question.
Hi, Ray from Kellerland.
Go ahead, Ray.
Hi, I apologize if you addressed this Monday, but President Trump and the Centers for Medicaid and Medicare released some guidelines saying that in states where the percent positive rate is 5% or above, they would recommend, or they strongly suggested, weekly testing at nursing homes. And right now, it appears South Dakota would fit into that. Is there some timeline, or how does the DOH approach that? Because we just finished a round of weekly testing.
So, Ray, that's a great question. So that recommendation is specific to staff in nursing homes, so I just make that clarification.
Okay.
We are currently working with our federal partners to advocate that recommendation be implemented on a more specific basis relative to counties that nursing facilities would be in, because as you can see from the data, there's variability in the level of cases, COVID cases across the state. And so we don't think a one-size-fits-all approach relative to test positivity is going to be very effective, being applied across the state. So we are still in conversations with our federal partners around that. The other update is that we know that there are 3 nursing homes in South Dakota who are on the immediate list to get their own testing machines. The goal of the federal administration is to get COVID test machines to every nursing home in the country, and so that will help nursing homes actually have the capacity to do the kind of testing that they're recommending.
And just a quick follow-up, does there appear to be federal money following that to help pay for some of that testing and additional needs that might come from that?
Yeah, I think nursing homes have been a part of all of the different CARES Act funding packages in recognition of the extra costs that they have in terms of dealing with COVID. And so certainly I would anticipate that they would provide financial support for this kind of testing.
And just one more, you said that part of the federal plan was to get testing equipment to every nursing home in the country.
Correct.
Okay.
That's over the course of several months.
Right. Thank you.
You're welcome.
All right, we have time for one final question.
This is Lisa with the Argus Reader.
Go ahead, Lisa.
Have you started any planning for how a vaccine will be distributed in the state?
So that's a great question. We're actively planning right now. In fact, there's been a lot of activity at the federal level with more information about how they intend to distribute vaccine kind of from a procedural standpoint, and so that's all very helpful information. We are in conversations with providers across the state to help collaboratively plan. This will obviously have to be a partnership between the federal government, the state government, and our healthcare community. We do have some aspects of planning from prior planning events that we've done, notably H1N1, that we will see if that can be relevant towards what we understand COVID vaccination needs to be. The latest information we have in terms of a timeline is that there is likely to be some kind of limited supply in late fall provided to states for specific populations, and that the vaccine will be more widely available starting in January 2021.
Okay.
All right. Thank you all for joining us today for